Safe transfer. This elderly resident is in frail health and suffers from arthritis. She is at a high risk for falls. Without the help of her nurse aide, she would not be able to transfer between her bed and the wheelchair. Transfers that are not performed correctly may cause injury to the resident as well as to the caregiver. Consider the observations of experienced nurse aides.
If a resident senses that you're unsure of what you're doing, they're not going to feel safe.
Many of the residents need emotional support for their transfers or just helping them because they may have had a fall in the past or they don't trust somebody.
So if you're sure of yourself, if you feel confident, then that'll make the resident feel a lot better and a lot safer with you.
It's very good to, try to calm them down and reassure them that you have control of the situation, and if they do it properly and follow your instructions, that everything will go well.
Always be careful and watch what you're doing. Keep your mind on what you're doing at all times.
Understanding how to transfer a resident safely can reduce the risk of falls and other accidents. Additionally, it can prevent injury to the caregiver, such as back strain and muscle pulls. As a nurse aide, you can help protect yourself from injury when you use proper lifting and transferring techniques. In some cases, a mechanical lift should be used for the safe transfer of residents who are heavy or who are in a weakened state and have little or no mobility. The purpose of this in-service is to show how to transfer a resident safely while preventing injury to yourself. We will discuss how you can protect yourself from back strain or muscle pulls by using good body mechanics. Additionally, we will provide examples of different types of transfers. At the end of this in-service, you should be able to list 4 major principles of good body mechanics, give an example of how to use a gait belt to transfer a resident, describe how to use a gait belt to help a resident walk, describe what may happen if you lift a resident beneath the arms, explain when a mechanical assist device should be used, and describe the action you should take when you notice a change or a decline in a resident's mental or physical condition. Federal regulations require that residents receive regular assessments to evaluate their mobility. These assessments often involve the input of a physical therapist. A resident's care plan should tell you what type of assistance the resident will need in transferring. It's important to remember that if you do not have the strength to transfer a resident by yourself, then you should get the help of another person or ask your supervisor about using an assistive device such as a mechanical lift. Principles of good body mechanics. Using good body mechanics can help prevent injuries such as back strain or muscle pulls. Transferring a resident using proper movements can help ensure your safety as well as the residents.
Proper body mechanics. That's it.
Paying attention to the things that you've learned in body mechanics is very important in transferring a resident in order to protect yourself and the resident.
In the following section, we will describe some of the key principles of good body mechanics. To do this, we will begin by using the example of moving a resident from a bed to a wheelchair. In this demonstration, the nurse aide uses a gait belt. When transferring a resident to a wheelchair, there are basic safety precautions that you must take in order to prevent an accident or injury to the resident or yourself. They include locking the brakes and folding the footrests up and out of the way. When you transfer a resident, you should explain to the person what you're going to do. Be sure the resident understands where he or she is going to move to. If the resident is able to assist you, then instruct the person on what he or she can do to help. An example is asking residents to stand or lower themselves. It is important to remember that if the resident has a weaker leg due to a condition such as a stroke or fractured hip, he or she should always lead with the strong leg during transfers. Transfer between bed and wheelchair. Step 1. Keep your back in a straightened position. Your head and shoulders should be upright. Place your feet shoulder width apart and slightly bend your knees so that you have a solid base of support. Put your arm around the resident's back to provide support as you swing the resident into a seated position with legs over the side of the bed. After you do this, pause for a moment to allow the resident to gain his or her balance. Step 2. After assisting the resident to put on appropriate footwear and after fastening the gait belt, position your knees on either side of the resident. Keep your back upright and knees bent. If the resident is able, instruct him or her to assist you by reaching back and pushing up from the bed. Lift with the strength of your legs and bring the resident as close to you as possible as you ease him or her into a standing position. Step 3. As you proceed with the transfer, hold the resident close to you and pivot or sidestep toward the wheelchair. Do not use a twisting motion because it may cause you to strain your back. Allow your legs to do most of the work. Your knees should be bent and your feet shoulder-width apart to help provide balance and stability. When you ease the resident into the wheelchair, ask him or her to reach back and take hold of the arms of the wheelchair. Let's now summarize some of the key principles of good body mechanics that we have just seen demonstrated. Principle number 1. Keep your back in a straightened position. Make sure your head and shoulders are upright. Place your feet shoulder-width apart and bend your knees. Principle number 2. Allow your legs to do most of the lifting or pulling. Do not use fast, jerking motions. Principle number 3. Position the resident as close to you as possible. This will help prevent back strain as well as provide support to the resident. Principle number 4. Pivot or sidestep toward the surface to which the resident is being transferred. Do not use a twisting motion with your back. Doing so would place you at a higher risk for injury. The principles we have reviewed can be applied to most other transfers, such as the ones involved in toileting or bathing. If you cannot transfer a resident by yourself, then get help or ask your supervisor if you can use an assistive device such as a mechanical lift. Knowing when to get help can prevent you and the resident from being injured.
Well, when you're trying to lift a resident and you feel that you can't do it by yourself, you should get help. Call one of your team members. And then if you try to move them by yourself, you could wind up injuring yourself or the resident, or both.
Using a gait belt. The use of a gait belt can make transferring and walking a resident safer and easier for both you and the resident. It may also help ease a resident's fear of being moved.
That belt means a lot, because you feel more secure when you got that around you, you know, in case you did fall or your legs did give out, that, you know, they can grab you right quick like.
Using the gait belt lets them know that you have something secure to hang on to. It's another way to reinforce to them that it's okay. I'm in control of the transfer. I can move you from this place to this place safely. I'm going to hold on to this, and it's snug, and I just think it gives them some security, and it also helps you have a very good control on the patient.
Because a gait belt is fastened around a resident's waist, it provides a handle for the caregiver to grasp. This allows for better support and helps you to move a resident with greater ease and safety. Another important advantage is that if there is a loss of balance or the resident begins to fall, you can use the gait belt to ease him or her to the floor if necessary. In this way, a gait belt may help you to prevent falls or injuries.
Using the gait belt, that gives you confidence, myself the confidence that the resident is going to be safe because I'm holding on to the resident. And then you're kind of guiding the resident in the way that you want them to go, and that supports them. That gives them a good feeling about themselves to know that you're there, and by that feeling of the belt, they know that you're with them.
Transfer lifts that are performed without a gait belt may place a frail, elderly resident at a higher risk for injury. Lifting beneath the arms can result in bruises, nerve damage, or shoulder joint dislocation. This type of lift is not recommended. Typically, a gait belt can be used in transfers involving toileting, bathing, and moving between a bed and chair or wheelchair. Gait belts can also provide added support and safety when walking a resident to another location, such as the dining area. The following is an example of performing a transfer with a gait belt. The transfer will be from a chair to a standing position with a walker. Step 1. Explain to the resident what you are about to do. Place the gait belt around the resident's waist and buckle it. The belt should fit snugly. Allow enough room to fit both of your hands between the resident and the belt. Step 2. Securely grasp the belt around the sides. Instruct the resident to reach back and push up from the chair using his or her arms. Bring the resident to a standing position. Make sure the resident has a secure hold on the walker handle grips. Step 3. When you walk the resident, stand slightly behind and to the side. Firmly hold the belt with your hand. This will help you guide the resident and provide support as he or she is walking. Once a resident is tired or ready to stop, you can use the gait belt to transfer him or her to a chair or bed. For frail, elderly residents, walking is an important part of helping to maintain or improve their mobility. It also provides them with the opportunity to socialize and move about the facility. As a nurse aide, you should also be alert to a decline or change in a resident's condition. The information you report may be essential in determining if a resident will need more assistance with transfers. Mechanical assists. Mechanical assists are usually appropriate for heavier residents or residents who lack mobility and are in a weakened state. One of the most common types of equipment used is the mechanical lift. Although there is a wide variety of lifts available, most of the mechanical devices operate along the same basic principle, supporting the resident in a seated position on a sling and elevating him or her mechanically. The frame of the device is mounted on wheels so that you can transfer the resident to a desired location where they can be lowered and released. Some facilities recommend leaving any assistive pads or slings under the resident until the return transfer. The goal of this practice is to help assure a safe return and relieve strain on the caregiver who is providing assistance. Although a mechanical lift takes more time to perform, it makes transferring easier and safer for both resident and caregiver. Instruction on the proper usage of a particular device should be given by qualified personnel. Program Summary. For your post-test, you should be able to list 4 major principles of good body mechanics. Give an example of how to use a gait belt to transfer a resident. Describe how to use a gait belt to help a resident walk. Describe what may happen if you lift a resident beneath the arms. Explain when a mechanical assist device should be used. And describe the action you should take when you notice a change or a decline in a resident's mental or physical condition. It is important that residents have confidence in your ability to transfer them safely and without injury. You should always take into account a resident's physical and mental condition. Some may have enough strength and mobility to assist in their own transfer, while others may not. Patience and gentleness can help ease a resident's fears.
It's all in the tone of voice. Okay, you have to have that tone that is reassuring.